Hey, EO Live TV, thanks for jumping in with us today. And as always, it's great to have Carrie with me on this CHD COVID-19 update. It's been a couple of weeks since we were together. And I don't know, first of all, let's do a check-in. How are you doing?
I'm doing okay. I have some days where it feels like a little bit quieter than others. I've been running back and forth between meetings here and there today, but I think that right now the workflow is getting a little more steady and a little bit more regular, but it does seem like we get surprised every now and then. So, but yeah, I'm good. Thanks for asking.
Well, good. Well, hey, let's launch. So the whole recovery number thing, that's been something that people have followed and asked. I've seen repeated questions about, hey, why aren't those numbers certainly out of 300 people more than, a half a dozen or a dozen have recovered? Talk a little bit about why that's complicated and then the changes that have come about in that reporting model.
Yeah, so thanks for asking about recovery. I think that I really, whenever I talk about this, I really want to start out by saying that, I understand that our community wants to know how people are doing, right? They want to know that if people that got the virus, if their health is improving, if they're moving beyond, their illness, whether or not they had a severe illness, are they okay? Like that. I really appreciate that about our community. It's one of the things that I'm really grateful for, that we care about each other. And I think that people also want to know, maybe, again, and I make some speculations about what people are trying to get to when they ask this question about recovery. How many people in the community are transmitting the disease? If we've had people that tested positive, when are we going to know that they're not out there spreading it anymore? I mean, there's all these, really, important questions I think our community members want answers to. One of the things that we have found time and time again, and I'm pretty sure that early on in the process, before we were even reporting out on recovered, we shared that that piece of information doesn't necessarily answer the questions that people want to have answers. And I think, our concern is that we're providing the community with valid, useful data that I feel like with the recovery numbers, it's not very useful, and it's really not answering those questions. So, reality is that at this point in time, there are many, many definitions of recovery. And as we're still learning about the disease, we don't really know whether or not, definitively when somebody stops transmitting the virus. We don't know definitively if people are transmitting it asymptomatically, pre-symptomatically. We don't know how long people retain immunity after getting the virus, if at all. We're still in this process of learning. And so what, people have done is we've kind of, picked, timelines for things like recovery. So, for example, we have a timeline and we'll tell you when your isolation needs to end. So we'll say, we want you to have a minimum of 10 days in isolation if you are testing positive. And then you need to have, on top of that, you need to have 3 days where you haven't had any symptoms. Your fever is gone and your other symptoms are improving, right? That doesn't mean that at the end of that time period, we have, a definitive answer that person is not still carrying the virus. It's just that based on the information that we have at this time, these are the time periods that we've selected. And so we feel really uncomfortable sharing information about recovery without feeling like we have a good sense of what that means. And again, there are multiple definitions of recovery. And it just, again, it's the other thing that we've really been faced with is that early on, the Oregon Health Authority was contacting people and assessing this whether or not they met this definition of recovery that they had determined. And they have decided not to use their resources in that way anymore. And to be honest, we don't really have the resources to be spending our time doing that right now either. I mean, we feel like it's most important for us to focus on the contact investigations and the contact tracing so we can work with people that have symptoms of the virus and keep them away from other people so they're not spreading it. We want to identify the contacts, the people that we're really, concerned about having a high risk of developing the virus because they've been in contact with somebody else. And unfortunately, when our workflows have changed so significantly in public health, and this is not just in Union County, this is across the board, hence probably why the Oregon Health Authority is no longer able to make these recovery phone calls, is that we really need to prioritize where our resources are best spent. And right now, at this point in time, it's just not a priority for us. And until we feel like we can find a good piece of data to reassure the community, I think that we're not going to spend our time contacting people and getting information that doesn't really answer the questions, if that makes sense.
Yeah, no, I totally follow you. And the term that I used before we were on the air was that it's mushy. The definition is mushy. The number is mushy, and I've had people ask me, well, how come they're not reporting on recoveries? And my, I kind of said what it is. That was my guess. My guess is that they're overwhelmed and that data really isn't important compared to the other tasks that they're dealing with, And I do think that people are concerned about those things because not knowing it increases fear. That's the bottom line is that, so if you, if you're local and you've had COVID and with confidence that, hey, it's been 30 days since I experienced that, I was responsible and I, quarantined myself and so on and so forth. But if I can't wear a badge that I'm recovered, then there's a little bit of you still have this giant C19 on your forehead. And so, there's a lot of stigma with all of that. But the bottom line is that when you look at the stats, and even I, as much as I know about this, when you look at the stats and you say, yeah, there's this many positive cases and there's only this few that are classified as recovered, well, that causes fear. It's like, well, what do you mean? They're still, and so, yeah, I personally think that it was, even reporting on recovered cases to begin with was not very well thought through, just because there's so little that we know about that. So, so thanks for that explanation. And the thing is, still people just need to do, they need to do what it is that they know they're supposed to do. They need to be prudent, and it doesn't, even if you've had COVID and you've recovered from it, you're still not going to go get in people's faces. You're still going to wear a mask. You're still going to do all of the same things that you need to do to integrate with people, so.
Yeah, absolutely. I've said it multiple times. We're kind of going back to the basics all the time with this virus because, still our best and most effective strategies are the physical distancing that, we're asking people to do, staying home when you are symptomatic. Of course, it's really, really critical. But, we've continued to learn about this virus. And I feel like at this point in time, we still have more to learn. And so, in the knowing that people are recovered, it doesn't necessarily give you an information about whether or not and when they're spreading shedding the virus. We don't know if somebody has the virus and wasn't tested. There still could be people in our community that have the virus. So again, if people are concerned, and I get it, I'm concerned too, their best steps that they can take doesn't have anything to do with the information we're sharing other than the information we're sharing about what you can do to protect yourself. And so that's really, again, what we need to focus on at this point in time. And, again, I really understand people's concerns. And I think that if they are afraid and again, like I understand people are the recovery number isn't going to give them the reassurance that they need. It's all of those other steps that we've asked them to take that will really keep them the most safe.
Yeah. Thank you. So let's talk about testing. So talk about where that's at, where the results are at, and kind of talk about a little bit, because that kind of is a fly in the ointment right now. Talk about what's happening there.
Yeah, early on when we started responding to COVID-19, I spent a lot of time watching the news, and I have not been keeping up on the national media, but I think that this testing challenges that we're facing are being experienced across the nation, not just here in Union County. Of course, early on, we didn't have a lot of supplies for testing. We were really prioritizing the individuals that we were testing to make sure that we were best managing that resource. So we were really only testing people that had signs of the disease and, again, close contacts. And we've kind of gotten back to that strategy given the experiences that we're having with testing. So right now, we're hearing that there are potentially supply chain issues happening beyond us. They may be happening. I don't know if they're, currently happening, but I think it's anticipated. And then once we upped our supplies initially and we're able to do more testing, expanded our testing criteria, then the labs got overwhelmed. So we've been using the private laboratories to do the testing, and the volume was so much that their ability to turn those tests around really quickly has been limited. And so again, we're in this situation where we do a test, we're asking somebody to isolate for a certain period of time or quarantine for a certain period of time, depending on whether or not they have signs of the illness or were a contact to somebody that had the illness. And in some cases, we're not getting the test results back before the end of that isolation period, which again, really doesn't allow us to do the contact tracing and contact investigations that we have been relying on to slow the spread of the virus and to protect our most vulnerable community members. So at this point, again, we kind of need to go back to the basics. If people are symptomatic, we need them to stay home. If they're ill enough to go to their provider, we want them to do that. And the provider has discretion to test. But at this point in time, just doing a lot of testing isn't getting us the outcome that we want.
So to break that down a little bit further, somebody could get a test, and ideally the test results would be back in 2 or 3 days. It seems like there was a period of time when that was kind of happening. But since now there's a delay, and as if somebody is experiencing enough of the symptoms to be tested, that they do test, then you're asking them to isolate themselves until the test results come back. Then the test results come back and you guys follow up. If they're positive, then you follow up with the contact tracing procedures and find out and do that whole procedure. But if that test result getting back is delayed, then they're not going to self-isolate forever. They're just, they're maybe, there's a high possibility that even if they were positive, that they moved through the illness by the time the test gets back. So the bottom line still is what you're saying is, if you're sick, stay home. If you're sick, don't be in contact with people. Act as though you do have it. Act as though the people that you're interacting with do have it, and protect yourself in that manner.
Yeah, and I do want to say that, the lab that we're using and at CHD Public Health is having delays. I don't know that that's true of all the laboratories. And I think, if you were severely ill and you went to your healthcare provider and they identified that a COVID test would be a good thing for you to have, your turnaround time may be more quickly than we're able to get it through the lab that we're currently using. But I think, again, it does go back to the fact that if you are symptomatic and you have a COVID-like symptoms, regardless of whether or not you get a test or whether or not you test positive, the instructions that we are going to give you are still the same. We are going to tell you to stay home for a minimum of 10 days. And then we're going to ask you to also make sure that you're free of fever for 3 days and that your other symptoms have greatly improved before you go back out into the world. And so I think that, again, it's nice for us to have that definitive answer. But even when we get that definitive answer, we know that there's some false negatives. So if you have those COVID-like symptoms, even if you test negative, we really want you to follow those recommendations. And again, I've said this before many times, this is our strategy for containing the virus right now. We're focusing on individuals and slowing the transmission in people that we know have it. The alternative, if we end up as a state having a really significant spread of the disease, we would ask everybody to stay home. Right now, we're just asking people that are, symptomatic to stay home, people that have come in close contact with those symptomatic people to stay home. So again, this is a strategy for containing it, which, the alternative is having broader orders to have individuals stay at home. So we really, regardless of whether or not you get a test done, we need people that have the symptoms to stay home.
Good. So the governor announced earlier this week about some changes with gathering and wearing masks, and kind of go over that with us, if you would.
Sure. So starting today, the governor has issued a statewide requirement that individuals wear face coverings indoors in indoor public spaces. So those would be like grocery stores or, places that you're going that are indoors and open to the public. She's also asked that we wear the face coverings in outdoor spaces where we're not able to maintain the 6 feet physical distancing that we feel is so vital to slowing and stopping the spread of this virus. So, again, I know that a lot of our public spaces were already requiring masks, and I know that a lot of our community members were already using the masks, but now, of course, the governor has issued a statewide mandate for that to happen in those indoor public spaces and outdoor spaces where we can't maintain the distancing. She's also asked us to limit our social gatherings to 10 or fewer individuals. So again, this is really trying to make a focused, targeted strategy. We believe that this virus transmits when we're in close contact with each other in group settings and indoors in particular. I mean, of course, I think outdoors you can still transmit the virus, but we think the indoor settings are much more likely spaces for transmission to occur. So again, she's asking us to slow the spread and limit the transmission by limiting our group interactions with other individuals. And of course, this is along with all of the other guidance that we had in place already. And these are steps we're taking to just try and get the spread a little bit lower. We've seen our numbers in the state rising over the last couple of weeks. And so again, she's just continuing to put some mitigations in place to hopefully curb that, so we don't have to have additional restrictions or guidance put in place. So
previously it has been, and it's important to drill down on this because I don't know, people are confused by this, but it was indoor public spaces where masks were supposed to be worn. And I was out of town this last weekend, was in Joseph, and I'm seeing a lot of compliance personally, which the stores that I went into, in fact, I can't think of a store that I haven't been in that didn't say, please mask up. I've had to go back to the car and get mine, and but still, I've seen a lot of compliance. And if you didn't have a mask, I've seen several of the stores have, a box of masks, unused masks right inside the door so people can comply. So, but what has changed recently is that she suggested that social gatherings be no more than 10, and even in outdoor spaces where you cannot maintain 6 feet of social distance, then you should also wear a mask. And what's funny is that in Eastern Oregon, that's not hard for us. I mean, most people don't really want to be within 6 feet of people that they don't know anyhow, so I guess I'm not seeing that would be difficult for us to comply with.
Yeah, and I think, I've definitely been out in the community a few times and seen lots of folks, wearing their face coverings. And, it definitely seems like people are starting to, just make this part of their everyday lives more. And I know for me, even me, it's like a little bit of a hard transition because I'm doing something that I'm not used to doing. I have to get in the habit of putting it on. I have to think about it. It's definitely something that wasn't part of my normal day-to-day life before all of this. And now I'm kind of starting to get into the routine. And, just the other night, I went into an establishment and it was, obviously before these changes had happened. I've been wearing it anyway when I go inside somewhere, and I walked inside and I looked over and I saw somebody else with their face covering on. And I was like, oh no, like I forgot mine. And then once I realized it, I kind of felt like weird because I'm like kind of getting used to wearing them when I'm in these public spaces. So, again, I just remind people the reasons that we do this are to keep each other safe. And there are a lot of studies coming out that they really do make a difference in the spread in our communities. And this is something that is in our hands that we can control, that we can do to keep the spread as low as possible. And again, the reason why we want to do that is so when we get sick, that our healthcare system can take care of us.
And I mean, as you know, through our conversations, I've kind of drug my feet from time to time on this, so I guess I'm happy to comply and to protect myself, protect the people around me. These things make sense, Me personally, I am not wearing a mask when I'm driving in my car by myself, and then for somebody to look at me driving down the street and judge me because I'm not wearing a mask in my car by myself, is outrageous. So we're still intelligent human beings, and we still have to be able to use our own judgment. And I think that's kind of where East Oregonians get a little bit bound up sometime. We need to do what's prudent. We need to do what's effective. But, if you want to be outside and you want to stay 20 feet away from people and you don't want to wear a mask, you shouldn't be judged, and if people are judging you, they really don't understand what the governor has been saying. So anyhow, so get off my little soapbox there. So
yeah, and I think this is, again, I think we just have to assume best intentions with everybody. Right. And we're all coming from a different place. And this is like, you can't look at me and know what's going on inside of me, what my reasonings might be or not be. You can't look at me and know if I have an underlying health condition. Like, I don't wear my mask if I'm alone in my car, or even if I'm with my household members in the car, because we're all, in close contact anyway. But at the same time, like, I do see people driving down the street with them when they're in their car, seemingly on their own. And I also have to assume they have a good reason for doing that. I mean, maybe they want to leave it on so they're not maybe they touched something before they got in their car and they don't want to contaminate their mask or their face by taking their mask off. Yep. So I think, again, this is not about taking sides. It's not about judging our community members. It's about remembering that we're all doing the best that we can to keep each other safe and to limit transmission.
Yep. All righty. Well, what else? Is there anything else that we kind of need to hit on that you can think of that's relevant?
I think that's kind of the top issues that we have to talk about this week. Again, we're just really grateful that we've seen a leveling off of the cases. And I think we're still seeing cases. We're still seeing people that are testing positive for the virus. It's still circulating in our community. And so, I definitely want us to continue to stay vigilant, as we've said so many times. And, take the precautions that we've asked people to do. And again, to keep the vulnerable people in our community most safe, the ones that are really going to have a hard time with the weathering the virus.
Yeah. Yeah. And I was just checking Facebook, a lot of kudos to you guys for the work that you do. Yeah, who'd have thought that, I don't know, how long has it been, 5 or 6 months now, that we would be in this place. And, as school gets ready to start here in a bit, we're going to have to navigate that and whatever that means, so it is where we are. So, yeah. And I'm, as inconvenienced as it is, I was at a family gathering not too long ago and with my own children, but we're not in the same family group. And I mean, we're not used to hanging around with each other. And so we had to be careful, and it's inconvenient. We couldn't love on each other the way that we normally do.
And it's, at least they're there, I mean, I think that's the thing that we have to remember is that, we need to act a little bit differently, but, we don't want to lose somebody because they got the virus and were able to weather it. So, yes, it's inconvenient, but there's really good reasons why we're doing it.
Yeah. And I guess I get the numbers every day, that you guys send out. I see the trend. I mean, I think it's been positive. There've been a couple of days where we haven't had any cases that were reported, but the numbers are, they seem to be smaller. So that's, I think that's a good sign of it being contained or being more contained. But it only takes one incident. It only takes one careless time for us to have another big big outbreak. And so we just need to keep on keeping on doing the things that we know we need to do.
Yeah, definitely. I think one of the things that that just occurred to me that might be useful to share, as we move into this kind of, next phase, I don't know if it's the next phase, but maybe a phase where this is starting to become more of our normal day-to-day lives. I don't know that I see it. I don't know when the end of this is going to be. I don't have a crystal ball, although sometimes that would be nice. We're really going to start and continue. I wouldn't say start because we've been doing it all along, but we've been working a lot with other organizations in the community to make sure that we can have the greatest success in supporting all members of our community. And again, really focusing on those that are most likely to need support during this time. So, somebody who is asked to isolate or quarantine, that can be really challenging for a lot of individuals in our community. It could affect your ability to bring in income to support your basic needs. You might not have somebody to go out and get you food, which you're not supposed to do if you're isolated or quarantined. You might need some supports that are not readily available to you and may not know how to even go about getting help because this is a new situation that you've never been in before. So we've been partnering really closely with a lot of different entities in the community, community-based organizations, organizations that are working with different groups in our community. And I don't know that I want to name all of them because I'm afraid I'm going to forget somebody when I'm on the spot like this. But so we've been having regular in multiple calls a week where we meet with these entities that are working with the various populations in our community to coordinate, collaborate, strategize, and really make sure that we have the supports and resources available to provide information to the community in ways that are accessible to all of our community members and to provide support services that folks might need. So we actually have a single point of contact set up for individuals that might need supports. If they're asked to isolate or quarantine, we call them WRAP services, which basically means the wraparound services. So, making giving all kinds of support. And the list can be very long of the types of support people might need. And our job is really to try and help facilitate getting people connected with those resources. So I did think it would be good to share the contact information for those WRAP services, just to make sure that people in our community who are being asked to isolate or quarantine know that they can get support like that. Again, we do our best to communicate that information through the course of contact investigation and contact tracing. But I do think it's good for our community to also know that we have those resources in place to help our community members. So anyway, to access those services or to get more information about services that folks might need, they can call 541-663-4252, or they can email COVID WRAP services, and actually it's not spelled out, it's COVID, COVID, WRAPSVCS@unioncounty.org. Sorry, that one's a little bit.
And actually, I put that on the screen, so that's okay. People are able to see that. So,
perfect. And I just really, one of the things that has been really hard about being the person who's coming and talking to you each week is that you are seeing my face, but it does not in any way reflect the numerous individuals that are working that you're not seeing on the camera each week. And so I am definitely, there are so many people at CHD in our public health team and beyond that have been supporting this response work. There have been numerous volunteers that are, Union County Incident Management Team, the county emergency manager deployed a large number of volunteers to help with all kinds of things, the testing events that were done at the fairgrounds. And then again, our community-based organizations, the people that are doing those WRAP services, they're volunteering to their time to this cause. So, I really just want to acknowledge that this is a community effort. It's a team effort, and that there are a lot of people that are really, really working hard to keep our community safe and support people that need support during this difficult time.
Yeah, and I appreciate that and get that. When we talk about the follow, at the beginning, I talked about the even reporting on recovery cases. It takes so much manpower, especially, it takes a huge amount of manpower. I'd imagine with the glut of cases that we had all of a sudden to track all of that, to track the contact tracing. I just know you guys have been overwhelmed with making that all happen. And I just say kudos that, certainly things are declining, things are getting better, and we just need to continue to be prudent about doing what it is that we know we need to do.
Yeah, absolutely.
So, all righty. Well, Carrie, thank you so much for taking the time to be with me. And I think the plan is to maybe begin doing this every other week. So if I don't see you next week, we'll see you the week after. And EO Alive, thank you for tuning in, and also just always appreciate our sponsors, Grand Ron Hospital and EONI. And thank you again so much for being with us today.